Is your pee really smelling funny? Or do you feel like you have to go to pee like a bazillion number of times, or you feel like you don't ever want to leave the bathroom and it just hurts? Like it might not be agonizing hurt, but it just hurts to pee. Is that what is happening to you? Or sometimes there's cloudy urine, or sometimes very dark colored urine, or sometimes red urine. Has that happened to you? That's because you have a lower urinary tract infection. So, normally, bacteria should not be there in kidneys, ureters, urethra, bladder. No, there should be no bacteria. It's a sterile space. So, the urine which we pass out is actually absolutely sterile. When it comes out, it mixes with the bacteria. That's when it releases the ammonia and it smells. But otherwise, it's a clean, sterile urine. It should not have any bacteria. But because of sexual activity, or when you're pregnant and sexual activity, or just being pregnant sometimes, can lead to recurrent UTIs or urinary tract infections. These infections sometimes produce no symptoms, and some patients, because of the pure laxity of the whole area down there, because of the hormonal effect, chances of urine staying stagnated in bladder and certain areas of the tract are higher, as a result of which the bacteria keep staying in. So when this is happening, you need to get it tested. So all those symptoms which I said, burning, frequency, the smelly urine, it's just like a very typical smell. A patient who has had urinary tract infection, she knows she's having an infection when she smells it. It's the bacteria in the urine. So when this happens, we do a urine culture, which is a test to see if there is bacteria in the urine and which antibiotic will work for this bacteria. So that's when we give our patients antibiotics, because if we don't give you antibiotic for this urinary tract infections, then this bacteria will rise up. It can go to kidneys, and you don't want to mess with kidneys, because kidney is a very forgiving organ till 70% of its capacity, and when it's like really 70% damage, that's when it starts crashing down. And sometimes all these infections, if they reach the kidney, can scar the kidney and produce future high blood pressure, kidney damage in the future. So every urinary tract infection is important, is to be treated. Plus it's so distressing. So don't fear taking the antibiotic. And sometimes these infections don't go and they keep coming again and again. And the doctors might put you, especially the urologist, might put you on an antibiotic for a long term, which is really a killer. In my heart, I don't ever want to put a patient on such a long antibiotic, but the stress and the agony associated with the urinary tract infection is sometimes it mandates us to do that. And how does it affect the baby? If you have a recurrent urinary tract infections, you are at a risk of second trimester miscarriage, preterm labor. And if you get affected, as in you get pyelonephritis, as in the fever and infection goes into your kidneys, that's when it's really serious. We don't want you to be affected when pregnant, because if you're not well, your baby's not going to be well. Sometimes these infections can be asymptomatic, as in there is no symptom and it's just going on inside. That's why the urine culture is a part of booking checkup, as in every pregnant patient has a urine culture even when she has no symptoms. So if you're someone who's suffering with urinary tract infection, come and get coached.